Is Martine on the line?
Yes, I'm on the line.
Martine, hi, how are you?
Yes, hi.
Welcome.
Hello, everybody. It's really hard to take the floor after those very powerful words. Thank you for those words anyway, and to Pope Francis's message as well. And thank you, Jeff, for setting the scene. I want to thank you, of course, for the invitation to participate in these 2 days meetings on poverty. It's hard to make the link, really, frankly, from what we just heard, but what I'm going to present in those 5 minutes that you have allocated to me is about trends in well-being in OECD countries. As Jeff mentioned, those countries are often called the richest countries or the most developed economies. I'm sure Sabina will complete my talk with a focus on more developing countries. But I used to be the chief statistician of the OECD until not long ago. And there we developed I launched the Wellbeing Initiative at the OECD and tried to develop measure of well-being that go beyond GDP and economic problems. So this is the basis of what I'm going to talk about. But I would like to start by saying that perhaps coming to more recent period, the COVID-19 period, as strongly the pandemic has perhaps dramatically brought to the fore some of the fundamental questions that we are going to be discussing over the next 2 days, but that strongly emerged prior to and in the aftermath of the 2008 financial crisis, such as what is important for people's lives, what is social progress, and are we measuring what matters? Are public policies contributing to the improvement of individual and society's well-being? I think that what the pandemic really has clearly revealed is that there is more to life than GDP growth, indeed, that people also value very much economic security. They value health, of course, and we saw that during the pandemic, not only physical health, but also mental health. They also value what were so-called essential jobs, those invisible jobs before the pandemic: education, adequate housing, community and family relationships, institutional support, and a sense of belonging and respect. It has also revealed that vulnerable groups, those disadvantaged in society, have been proportionately affected, both socially and economically. Those in precarious employment, those living in poor living quality housing, socially isolated, those struggling with anxiety, worry, and low subjective well-being more generally, have suffered most during the pandemic. So what have we seen? What are we seeing in terms of trends in well-being in poverty in OECD countries? Let me just recall that just prior to the start of the COVID-19 crisis, on average across OECD countries, around 11% of the population, 1 in 9 people, lived in relative poverty as defined by Jeff a moment ago, meaning with an income with less than 50% of the median income. But importantly, life was financially very precarious, not just for this 11% of the population, but for many lower income households who are not counted as economically poor in official statistics. Indeed, almost 40% were at risk of falling into poverty if they had to forego 3 weeks of their income. So you mentioned the poverty line, Jeff, but just above the poverty line, 40% of people who are just above the poverty line are at risk of falling into below the poverty line in OECD countries. At the same time, as you mentioned, there are large economic inequalities that persist in most countries, with people in the top 20% of the income distribution earning more than 5 times more than people in the bottom 20. And 1 in 5 households having difficulties making ends meet in European countries. But wealth is even more concentrated than income, with the wealthiest 10% of households owning 52% of total wealth on average in the OECD. And at the other end of the spectrum, households in the bottom half of the wealth distribution own little or no wealth at all. Despite massive public economic support in most countries, the COVID-19 crisis exacerbated the risk of economic insecurity and poverty. A recent OECD survey shows that almost a third of households have experienced financial difficulties and had trouble paying bills, while some went hungry because they could not pay for food, in particular single parents and younger people. Very worryingly, I think, for our future, we have seen a shift in the risk of being economically poor from older to younger generations over the last decades. Since the mid-80s, the poverty rate of young people, those between 18 and 25, has risen from 10 to 16% in OECD countries. But as we said, it's not just about economic poverty. Well-being disparities and deprivations in non-material dimensions of well-being are also widespread. Let me give you some numbers. 16% of all adults in OECD countries have skills below the minimum needed for everyday life. 10% rate their health as bad or very bad, and 6% have experienced depression with rises in death of despair, those deaths from suicide, alcohol abuse, and drug overdose. 12% of households live in overcrowded housing. 26% do not feel safe when walking alone at night in their neighborhood. And around 10% report having no relatives or friends they can count on in times of need. More than 20% of people are exposed to severe air pollution, especially those living in deprived urban neighborhoods. And finally, around 7% report very low level of subjective well-being or happiness. But going even further, this picture of well-being in OECD countries is far from being exhaustive. There are many statistical gaps. The very poor and those excluded from society are invisible, in fact, in the numbers. They do not appear in official surveys. A recent report from Oecd Fourth World, conducted with the University of Oxford and directly involving people who live in poverty, shows that there are hidden dimensions of poverty that are typically not captured in official statistics. People experiencing severe living conditions say they not only suffer from lack of decent work, insecure income, and material deprivation. More important for them is suffering in the body, mind, and heart, a sense of disempowerment and lack of control, a constant state of fear and uncertainty, suffering brought from lack of recognition, abuse, and maltreatment
to be in the
by
time.
institutions.
Sorry, you have only 1 minute because
Yes.
really we don't have.
I'm finished. I'm almost finished. That fail to respond respectfully to their needs and circumstances and humiliate them, and maltreatment by other individuals and informal groups. It's very important that we collect more information, both quantitative and qualitative, on these hidden dimensions of poverty. So let me just move on and finish with this. So what does it mean for economic policy, as Jeff asked earlier? Overall, I think it's clear that conventional economic models have failed us, and many of the policies implemented across the OECD over the past years appear unable to improve economic, environment, and social outcomes, and to reduce poverty and deprivations in well-being. And in fact, less than 50% of people across OECD countries only 50% trust their governments and institutions to address their concerns, with only 1 in 3 people feeling they have a say in what the government does. So I think that even if some countries such as New Zealand, Finland, or Scotland are experimenting with new approaches that put well-being at the center of policymaking, there's still a lot to be done, and we're still at early stages. All of these countries, by the way, have set the reduction of poverty, in particular of child poverty, among their highest priorities. So I think There's a lot to do. The COVID crisis has clearly shown that there's more to life than GDP growth, and that it's now time to reset our vision for a post-COVID world, taking on board all those other dimensions of well-being. Thank you.
Thank you so much, Martine. And for all your leadership in helping to develop these new data and uncover these crucial facts. I'm very